Okay, please come to this.
Yes. Dr. Hamdan.
So Dr. Hamdan Nahdi, please. Yeah.
Assalamu alaikum. It's my pleasure to introduce today Dr. Saiful Huq, Vice President of the newly formed associate AMSTRO, and one of the principal architects, along with a small group of colleagues who helped shape its mission and vision. He also played a central role in shaping the program and structure of the AMSTRO 2026 Global Oncology Conference. Through decades of global work in radiation oncology and cancer care, Dr. Saiful Huq leadership has been recognized at the highest national and professional levels, including the U.S. Presidential Gold Medal and Lifetime Achievement Awards, as well as the College Gold Medal, the highest honor of his professional society. Please join me in warmly welcoming Dr. Saiful Huq to deliver the welcome remark of his Ministry 2026 Global Oncology.
Good morning, everyone, and Assalamu alaikum. Moments like this matter because they mark the point where intention becomes commitment and where collaboration begins to change outcomes. They also mark the moment when we decide that continuing as before is no longer acceptable. It is truly a privilege to welcome you to Dubai for the inaugural AMSTRO 2026 Global Oncology Conference. Your presence here from across Asia, Middle East, and the world signals a shared commitment to shaping the future of cancer care in our region. On behalf of the AMSTRO Board of Directors, I would like to express my sincere gratitude to our hosts, our partners, and our sponsors, and to each of you who has traveled often across from continents to be here today. Your participation affirms that this gathering is not only timely, but necessary. Cancer care across the Middle East stands at a critical inflection point. The cancer burden is rising rapidly. Scientific advances are accelerating, yet access, equity, workforce capacity, and system readiness remains uneven. Sometimes profoundly so. If we do not align science, system, and leadership now, the gap between what is possible and what is available to patients will only widen. At the same time, this region is rich in talent, innovation, and leadership. What has often been missing is not expertise, but coordination, not ambition, but alignment. AMSTRO was created to address that gap. AMSTRO is not intended to replace existing societies, institutions, or initiatives. It was founded as a platform for collaboration across disciplines, across countries, and across sectors. A platform designed to connect existing strengths so that collective impact exceeds individual effort. A platform where regional leadership and global partnership come together with a shared purpose. This meeting was intentionally designed to be different. It is not only a scientific conference, it's not only a policy forum, and it's not only an industry meeting. Indeed, it brings together professional societies, ministries of health, academic leaders, health system executives, industry partners, and global organizations, because cancer care does not succeed in silos. In short, this meeting is about moving from alignment to action. Over the next 3 days, our focus is not simply on ideas, but on implementation. Not only on excellence, but on equity, and not only on innovation, but on system that works for patients. Let me briefly orient you to the journey ahead. Today, day one, it's about leadership, diplomacy, and regional action. It is about aligning voices, building trust, and establishing a shared direction. In just a few moments, we'll be honored to hear our opening keynote from Her Royal Highness Princess Dina Mered, whose global leadership and advocacy have consistently reminded us that cancer control is ultimately about people, dignity, and justice. Her voice sets exactly the right tone for this inaugural meeting. Today is about alignment. Tomorrow, day two, shift from vision to execution. We will focus on health systems, science, and regional empowerment, grounded in evidence and informed by global frameworks. Importantly, day two will also feature robust scientific sessions in radiation oncology, medical physics, and radiation therapy. The role of industry and health systems and the practical pathways needed to implement global commitment across our region. Day two is about building capacity, systems, and confidence to deliver. Day three is about commitment to measurable progress and shared responsibility. AMSTRO does not claim to have all the answers, but we are committed to asking the right questions and to building the partnership needed to act on them. More importantly, we are committed to staying at the table until those questions lead to action. AMSTRO will not be defined by this meeting alone. It will be defined by what happens after this meeting. The collaborations formed, the trainings expanded, the policies influenced, and ultimately the patients served. After the opening keynote and a brief coffee break, one of our board members will take a few minutes to articulate AMSTRO's mission, vision, and goal in greater detail. Think of my remarks as setting the stage. What follows will provide the framework that guides our collective work going forward. Let me close with this. AMSTRO is not just a society. It's a commitment to collaboration, to innovation, to equity, and to improving patient care across our region. Hence, how we honor that commitment will help define cancer care in this region for the next decade. I invite you over the next 3 days to engage fully, to question, to challenge, and to contribute. The success of AMSTRO will depend not on any single organization or an individual, but on all of us working together. With that, it is my pleasure to invite Dr. Nadeem Parvez, founding member and Secretary General of AMSTRO, to continue the opening ceremony. Thank you and welcome to AMSTRO. Welcome to Dubai.
Thank you very much, Prof. Saiful Huq. After these wonderful talk, what words can I say? It's amazing. To see you all here, that's amazing. So I welcome you all, and I did before, on the behalf of AMSTRO and ASTIF, to be here. So I have no written talk. So very simple. We are affected by the word cancer in our family, within us, around us, our family. And we are the people who are leading this discipline. This is the responsibility on our shoulders. I feel that. I'm sure you all feel that. So we need to work together to deal with this. This cancer is not easy. The word itself, cancer, is enough to shake you. And I'm talking about my personal experience and the experience of many people in this room. So as Prof. Saiful already said, this was my word, he said it before me. This meeting is only the starting point. This is not where we're going to stop. We have a mission, we have vision, we have our goals. And we are going to move together. Ask you all to pledge with me that we all work against cancer and we work together as a team to defeat this. We may not be able to eradicate it completely, but we try to do our best possible. So you all pledge with this? Thank you very much. I like that so many hands raised in this room. Now, so this is the formal inauguration. And I would thank, there's so many people working behind the scene. This AMSTRO is just born a few months back, but I can see the impact of it already. It cannot happen without every one of you in this room. It cannot happen. So I want to also thank people, and I want them to say their words who actually supported AMSTRO very strongly behind the scene. The first one I want to call is Mr. Dr. Abdullah or Professor Abdullah. You can say any name. He's Abdullah Najjar. He's the president of Arab Science and Technology Foundation. Without him, we cannot have started. Thank you. Welcome.
You know, we are an Arab Science and Technology Foundation, and all our talks has to be in Arabic. So I'll just say welcome to all of you in English, and I'm honored to be here with AMSTRO, but I'm sorry, it has to be in Arabic. So who understand Arabic, that's great. If you don't, we'll give you a translation later, inshallah. طيب بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين سيدنا محمد عليه أفضل الصلاة والتسليم. أصحاب السعادة والسيادة، السيدات والسادة، الحضور الكرام، يشرفني أن أشارككم اليوم افتتاح مؤتمر أمسترو للأورام. هذا الحدث العلمي الذي يجمع نخبة من العلماء والخبراء من مختلف دول العالم دعما لمسيرة التقدم والتنمية في دول المنطقة. تلك الدول التي تربطها أواصر تاريخية وثقافية وإنسانية عميقة تجمعها تطلعات مشتركة نحو مستقبل مشرق مزدهر إن شاء الله. في مستهل كلمتي أود أن أشكر دولة الإمارات العربية المتحدة لاستضافة هذا الحدث ممثلة بصاحب السمو رئيس الدولة الشيخ محمد بن زايد آل نهيان حفظه الله، وصاحب السمو الشيخ محمد بن راشد آل مكتوم نائب رئيس الدولة رئيس مجلس الوزراء حاكم دبي. بالحقيقة هذا الشكر ناتج عن قناعتنا التامة برؤيتهم المتقدمة ودعمهم المستمر للعلم والتقدم العلمي والابتكار، وعلى دورهم المحوري في جعل دولة الإمارات مركزاً عالمياً للمعرفة والتطور العلمي. نحن كمؤسسة عربية للعلوم والتكنولوجيا نمتن كل الامتنان إلى صاحب السمو الشيخ الدكتور سلطان بن محمد القاسمي عضو المجلس الأعلى للاتحاد حاكم الشارقة، الذي منح العلماء ما كانوا يرجونه لتأسيس مؤسسة خاصة بهم، فمنحهم صاحب السمو مرسوم خاص، قانون خاص لتأسيس هذه المؤسسة، مما جعلها في الحقيقة تتحرك بحرية عبر العالم ضمن قانونها الخاص في ضمن هذا المرسوم. سموه وفر لنا الدعم الكامل للانطلاق، والحمد لله سبحانه وتعالى الآن أصبحت المؤسسة ممتدة لتجمع العلماء من المنطقة من أكثر من 120 دولة أكثر من 70,000 عالم عربي يحاولون أنهم يعملون مع بعض في مجموعات وشبكات حتى ننظم أعمالنا. بالحقيقة في عام 2023 قررنا أننا نسكر الشبكة أو المؤسسة. قلنا يعني المجتمع العربي ما يبغون مؤسسات غير حكومية، كله يبغون مؤسسات حكومية، احنا متعودين على الحكومات هي اللي تمشينا. لكن مع ذلك لما عملنا استبيان 99% من العلماء المشاركين قالوا لا، نحن نحتاج إلى مؤسسة تقود عملنا. في الحقيقة المؤسسة العربية للعلوم والتكنولوجيا تأسست في مؤتمر مثل هذا المؤتمر. يعني في مؤتمر كان في عام 2000 اجتمع العلماء ورأوا أننا نحتاج إلى مؤسستنا الخاصة التي تنظم عملنا فيما بيننا حتى نخرج من الإطار التنظيمي اللي هو تضعه الحكومات نتيجة سياسات معينة. نحن كشعوب أو كمختصين نريد أن يكون لنا كلمة. ومنذ ذلك الحين حملت المؤسسة رسالة واضحة: تمكين البحث العلمي، دعم الابتكار، تسخير أدوات العلوم والتكنولوجيا لتحقيق التنمية في المنطقة العربية وإحداث التغيير الإيجابي في المنطقة. نحن نؤمن بأن العلوم والتكنولوجيا ليست فقط أدوات وأكاديمية، بل هي رافعة للتنمية ومحرك للتنوع الاقتصادي وجسر يربط بين المعرفة والابتكار. مؤتمركم أمسترو اليوم هو امتداد في الحقيقة لهذه الرؤية، بحيث أنها يعني تجمع العلماء والمختصين في المنطقة وتضعهم في شبكة واحدة. في الحقيقة هذه شبكة من 5 شبكات أخرى تابعة للمؤسسة في الهيدروجين، قانونيين في موضوع الملوثات الناشئة وغيرها. نحن نعتقد أن كل ما قدرنا، كل ما تمكنا من جمع العلماء في صفوف محددة أو يعني على مسارات محددة، كل ما أصبح تأثيرنا أكثر ونستطيع أن نؤثر على متخذ القرار في المجتمع. في هذا السياق بالحقيقة أشكر مجلس إدارة أمسترو وأعضاء الشبكة اللي هي شبكة آسيا والشرق الأوسط للعلاج بالإشعاع والأورام، وأشكر بالحقيقة جميع من ساهم في هذا الحدث وبخصوص صحة الأخت حمدة يعطيك الصحة والعافية، وجميع السبونسرز والمشاركين. كل الشكر لجامعة زايد على استضافتها لهذا الحدث. ختاما أتمنى لهذا المؤتمر النجاح والتميز، وأن يساهم مساهمة فعلية في إحداث النقلة المطلوبة في مجال تخصصكم لخدمة المنطقة. لكن قبل أن أختم أود أن أشكر يعني في كلمة خاصة للمرضى السرطان، يعني نخصهم بالتحية والإكبار. فأنتم أيها الأبطال تواجهون أصعب التحديات بصمود وإيمان لا يضاهى. نؤكد لكم أنكم في قلب رسالتنا، في صميم جهودنا العلمية، وأن كل ما نقوم به من بحث وتطوير وعمل مشترك إنما هو من أجلكم، من أجل إعادة الأمل إلى قلوبكم وقلوب أحبائكم. نسأل الله القدير أن يكتب لكم الشفاء العاجل وأن يمن عليكم بالصحة والعافية، وأنتم بالحقيقة ملهمون لمزيد من التقدم. شكرا لكم وبارك الله بكم.
Thank you very much, Dr. Abdullah Najjar. How many of you use the AI to translate the talk? Yeah? Okay. Yeah. So with this, you know, we have a good support from the government or say health authority in Abu Dhabi. And I want to introduce someone who's always supporting behind the scene. You may not see in the front much, but behind the scene, a lot of support. So I want to welcome Dr. Hamda Al-Niadi to come to the stage. She is Group Marketing Director of SEHA. So Dr. Hamda.
So good morning, everyone. It's really a pleasure to be here today with you at AMSTRO 2026 conference, which brings together a clear shared ambitions, regional leadership, global collaboration, and practical progress in cancer care. In oncology, we all know this. Patients do not experience care in departments. They experience it as a one journey. They remember how long they waited. They remember whether things were explained clearly, and they remember whether the system felt coordinated or confused. At Saha, this is exactly where we focus, not only on what we provide, but on how patients move through care, from first concern to long-term follow-up. Our oncology profile span hematology, pediatric hematology, radiation, surgery, neurosurgery, and oncology, supported by key subspecialty interface, including ophthalmology, orthopedic, and ENT oncology. But let me keep it so simple. Our approach is shaped by three commitments. First, access and continuity. Cancer care is already difficult. The system should not make it harder. So we are strengthening referral pathways, coordination between specialists, and continually access outpatient, inpatient, and treatment settings. Our goal is straightforward. Less delays, less uncertainty, and clearer next steps for every patient and family. Second, quality and safety by design. In oncology, consistency is not a nice to have. It is essential. That's why multidisciplinary tumor boards and team-based decisions are central to our model. We align surgery, systematic therapy, radiation planning around each patient's clinical reality, not around silos. Third, innovation with purpose. We continue the advancing in radiation oncology, including IGRT, tomotherapy, and brachytherapy, of course, cyberknife. But for us, technology is never the headline by itself. The real question is always, did this improve outcome? Did this improve safety? Did this improve the patient experience? If this answer is yes, we scale it as a responsibility. If not, we need to rethink. What I value about AMSTRO is that the agenda reflects these same priorities: collaborations, implementation, system leadership, and sustainable workforce development. That alignment matters because it means this region is not just talking about innovation, we are working on delivery. Eventually, I will close with this. The future of oncology is in our region will not be built by one institution. It will be built through trusted partnerships in training, in research, and in patient-centered model of care. At Saha, we are committed to being active partner in that future, a future where cancer is more connected, more measurable, and more human. And then at the end, I would like to share a video, an overview about Saha. Videos can be played.
Dr. Mani. So while we are opening the video, I can tell you that AMSTRO or this meeting cannot happen without the support of Seha. That was a great support, and we thank Seha. Thank you for the support. Yeah, we have in this room multiple people from different disciplines, and this is what we needed. It's not the only oncologist can deal with cancer. All of us, it's the problem of all of us. And the Seha is one of them who supported. So that's the, yes. Yes, start. No, that's the, yes.
No.
No. So, yes.
So
okay.
that's all. And from my side till they find the video.
Yes, yeah.
Thank you.
No.
Yeah,
Yes. So Prof. Saiful is a physicist. He's doing better than us. You know? Yes.
No, I know where, I don't know where it was kept.
This one, no? Okay.
It's behind it, I think. Can you?
This one?
Yes,
This one.
yeah.
Yeah, okay. Yes.
Just a second.
This one. Okay. So we're technically okay now.
psychiatric care.
Thank you. Thank you, Dr. Hamda. You know, as I mentioned that the cancer is the problem and challenge of the whole society. And in this room, I see the people who are non-oncologists. So I must thank that Zayed University who actually help us. Beautiful. So I thank the Zayed University for supporting us to have the meeting in this convention center. And among us, we have the Provost of University, Dr. Michael Allen. I would request him to come to the stage. This one, no, don't play now. Done. No, it's fine, just.
Thank you, Dr. Nadeem. Good morning, everyone. Your Royal Highness, distinguished guests, colleagues, and friends. Welcome to Zayed University's Dubai campus. We have another one in Abu Dhabi. And welcome to the inaugural AMSTRO Global Oncology Conference. It's a genuine honor for us at Zayed University to host what I hope will become a defining annual gathering for oncology across the region. I've been in Dubai for 20 years, and one of the great benefits to me has been the opportunity to be exposed to so many areas of human striving and human endeavor, which is one of the reasons why, though I'm not a medical specialist in any sense, I'm fascinated and deeply interested in this meeting. I'll be brief, but let me begin by thanking the Board of Directors and Organizing Committee of the Asia and Middle East Society of Therapeutic Radiation Oncology, AMSTRO, as well as the Arab Science and Technology Foundation, for the trust that you have placed in Zayed University and for bringing together this wonderful program. There are many different parts of the healthcare ecosystem in the room today, from radiation and medical oncologists to physicians, educators, government partners, and industry. This diverse presence reminds us that healthcare and oncology cannot be the responsibility of a single discipline. Progress is only truly made when we think of it in a multi or interdisciplinary way, bridging clinical excellence, strong systems, rigorous science, and commitment to equity and access. At Zayed University, our role as a national and federal university is to serve society through education and scholarship. As part of this, we look to explore the big, complex questions that matter, questions that are beyond the reach of just a single academic discipline. Though we do not have a medical school at Zayed University, the commitment of the academic profession to exploring questions that matter is one of the reasons I find this conference so important. Cancer care and how we treat and manage cancer patients is one of those big, complex questions. But why should a humanist and social scientist, a historian like me, be personally interested? Well, it's also a deeply human question, which impacts all of us and demands collaboration. It has impacted my family. My sister, my younger sister, passed away from cancer 10 years ago. The sister who, as I was growing up, was my best friend. So I feel deeply the kind of urgency that has been expressed today for collaboration, for early detection, and for good treatment. I'm sure it has affected the families of many of you here today. It's therefore a real privilege to convene this event. Conferences like this matter because they do something that policy papers alone cannot do. They bring people together, they get great minds in the same room, they begin conversations, and they accelerate shared progress. We are especially honored, genuinely, that Her Royal Highness Princess Dina Murad will deliver the opening keynote address in a few minutes. Her work has consistently reminded the world that equitable cancer care is both a moral imperative and a practical necessity. I had the great privilege of meeting her this morning, and I was energized by her energy and commitment. Thank you, Your Highness. I'm looking forward to hearing your speech. Over the next 3 days, I encourage you to make this conference both practical and inspiring. Take this opportunity to seek out partnerships that endure beyond this weekend. And if you're visiting Zayed University for the first time, I hope you'll take a moment to explore the campus a little bit. You won't have a chance to meet many of our faculty because it's the weekend, but you'll be able to at least see the campus that we enjoy and are grateful to work in every day. Thank you again for joining us. Welcome to Dubai, welcome to Zayed University, and welcome to AMSTRO 2026.
Thank you, Dr. Michael. Now I just take 1 minute of opportunity to introduce our board members, and I would like them to, if they can come on the stage. I'll start with Dr. Hussein Al-Kushi, who took the bigger responsibility of a president of the society with all his everyday busy clinical work when he do brachytherapy almost every other day in his center. Thank you. Welcome, Dr. Hussein. Vice President, everyone knows in this room, Professor Saiful Huq, with his guidance, with his mentorship, we would definitely know that we will be able to impact our region. Then, you know me, my General Secretary, Dr. Thuraiya Al-Hajri, she is working in Oman. So she's leading the Royal Hospital in Muscat, Oman, one of the among 2 centers. Dr. Laith Mullah Hussain, I thank him. He come far away from Canada. So he was in Oman at some time for it, many countries, but right now he's working in Canada, and he come all the way from there. Dr. Isa Muhammad is a radiation oncologist in King Hussein Cancer Center. And, you know, I kept the oldest among us is Dr. Abdulaziz Al-Ghamdi, who is working. He's working in Faisal Hospital. Everybody knows this in this region. It's one of the a very good center. Just don't look into his age. He's a very wise man. So we'll take a quick picture and we'll move forward from there then. So if you don't. So all the speaker of this session and Princess Dina Murad as well, if you allow us to.
Thank you. I gotta bring my notes. Okay.
Thank you very much. And we will move on from here to a very important session of this meeting and the day. So for this, I would request Professor Saiful Huq to chair this session. Mic to you, Professor.
So it will take me all day to introduce Her Royal Highness, but it's only fitting that I take a few minutes to introduce her. It's really a great honor and a deeply personal privilege to introduce our opening keynote speaker today. Her Royal Highness, Princess Dina Murad is one of the world's most respected, trusted voices in cancer control. She is not only a global leader, but a conscience for our field, someone who reminds us again and again that cancer care is ultimately about people, dignity, and justice. Her Royal Highness has served at the very highest levels of global health leadership, including as President of the Union for International Cancer Control, the world's largest cancer organization, becoming the first Arab woman to hold this historic role. In recognition of her extraordinary leadership, the United Nations named her an eminent champion in the fight against non-communicable disease, a distinction reserved only for those voices that do not simply participate in global dialogue, but shape it. She continues to serve the global community through numerous critical roles, including as honorary president of the European Organization for Research and Treatment of Cancer, a member of the World Health Organization expert group on the elimination of cervical cancer, and a member of the United Nations University High-Level Advisory Committee on Gender and Health. Closer to home, Her Royal Highness transformed cancer care in Jordan through her visionary leadership of the King Hussein Cancer Foundation, building not just an institution, but a movement. A movement grounded in compassion, excellence, and the belief that every patient deserves hope, care, and dignity, regardless of circumstance. What makes her leadership truly exceptional is that it is shaped not only by policy and advocacy, but by lived experience. As a mother of a cancer survivor and as a lifelong champion for families navigating the most difficult moments of their lives. Her Royal Highness's voice continues to guide and challenge us through her writings and speeches in leading global forums, including the Lancet Nature Review Cancer and JCO Global Oncology. As we open the inaugural meeting of AMSTRO, we could not imagine a more fitting voice to set our moral compass, to remind us why we are here, why this work matters, and why leadership is grounded in equity and dignity must be must guide everything that we do. Ladies and gentlemen, please join me in welcoming our opening keynote speaker, Her Royal Highness Princess Dina Murad.
Good morning, everyone. السلام عليكم جميعا. بسم الله الرحمن الرحيم. Your Excellencies, distinguished colleagues, dear friends. Cancer is many things. It is relentless. It disrupts lives without warning. Like a serial killer, it moves stealthily, often invisibly, wreaking havoc until everything familiar is altered. And yet, in a deeply paradoxical way, cancer is also the ultimate revealer of truth. It has a unique way of stripping systems and people down to their essence. It reveals how societies truly value human life. It reveals who is seen and who is rendered invisible. It reveals whether dignity is upheld as a fundamental principle or rationed as a privilege for the few. And that is why this meeting matters today. Because cancer care is not simply a technological challenge. It is a moral one. For without moral clarity, technology alone does not correct injustice, but rather accelerates it. Without purpose, innovation does not close gaps. It could widen them. And without leadership rooted in equity and dignity, even our most advanced tools will only serve the few, not the many. And that is the responsibility we must all confront together. Cancer is not merely a medical diagnosis. It is a profoundly seismic human experience, I should know. One that penetrates identity, reshapes family life, threatens livelihood, and tests the very limits of hope. When a person hears the word cancer, the fear is not only of the disease. It is fear of abandonment, fear of impoverishment, fear of being invisible to the system at the very moment they are most vulnerable. And yet, across much of the world, access to care still depends on where you are born, how much you earn, and which passport you carry. To really understand this is to imagine for 1 second what it looks and feels like if you or your loved one who is struck with cancer, for example, cannot access quality treatment nor access to the financials needed to cover it. It's like looking at someone and saying, this magic potion that will save your life is here. It is available. But so sorry, not for you. We can sugarcoat it all we want, but it is about the harsh and tragic reality of depriving someone from available life-saving treatment. That reality should trouble us, not only as clinicians and policymakers, but as human beings, because access to timely, high-quality cancer care is not an act of charity. It is an expression of rights and justice. When treatment is delayed because radiotherapy machines are unavailable or broken, access to health and dignity is compromised. When families travel hundreds of kilometers for care that should be local, access is compromised. When pain relief, imaging, or essential treatment is rationed by income, again, access, and dignity are denied. We must be honest with ourselves. Inequity in cancer care is not accidental, nor it is inevitable. It is the result of choices. Choices as to what we prioritize, what we fund, and what we tolerate. I have seen what happens when dignity, justice, and equity are placed front and center of cancer systems. In Jordan, before the transformation of our own cancer system, we had many elements on paper. We had the latest machines. We had highly qualified health professionals. We had the buildings and the infrastructure. And yet, we were unable to deliver consistent, high-quality, affordable cancer care. That was in 2002. Those who could afford it traveled abroad for treatment. As for the rest, too often, we didn't even know what became of them. That reality was unacceptable. So we made a deliberate choice. We organized ourselves. We took ownership. And we decided clearly and unequivocally that cancer care is not a privilege, but a human right and must be provided on that basis. That decision was not easy. It required political will. It required long-term investment, and it required a firm refusal to accept the familiar excuses. This is too expensive. This is not possible here. It's not doable. And it's far, far too difficult. So let's just leave it as is. And what followed surprised many. Once dignity and equity became non-negotiable, solutions followed. And now the King Hussein Cancer Center is the jewel, or is a jewel in the Arab world, serving cancer patients from Jordan and the region equitably and with the highest of ethics. The story of transformation of the King Hussein Cancer Center confirms a simple but often overlooked truth. Equity does not emerge alone from just or pure declarations. It is built carefully, deliberately, and over time. It is built when governments commit to universal health coverage that includes cancer. It is built when there is a genuine ownership of the problem, matched by cancer control planning, grounded in the realities on the ground. It is built when workforce planning anticipates future needs rather than reacting to crises. And it is built when technology is deployed strategically, serving patients and systems, not displayed as a symbol of progress. Radiotherapy offers another powerful example. We know that half of all cancer patients will require radiotherapy at some point in their treatment. We also know that radiotherapy is one of the most cost-effective cancer interventions available. And yet, in many low and middle-income countries, access to radiotherapy remains profoundly limited. Not because radiotherapy is optional, but because systems, both national and global, have failed to plan for it holistically. And when I speak of systems, I mean local governance and national health planning. But I also want to call out the global health architecture that for more than 70 years has determined and shaped what counts and what does not. For decades, global priorities, financing, and technical support flowed overwhelmingly toward communicable diseases, whilst cancer and other non-communicable diseases were left on the margins. The neglect became so profound that a cancer patient in South Africa once said, with heartbreaking honesty and clarity, that he wished he had AIDS instead of cancer. because HIV had systems, funding, and global support behind it, but while cancer had almost none. During my years as president of the Union for International Cancer Control, UICC, I saw this reality up close. I remember quite literally embracing the first ever radiotherapy machine in Rwanda. One machine intended to serve approximately 14 million people. It was a moment of hope, but also of stark reckoning. I also remember standing before a state-of-the-art radiotherapy machine in Ghana, still sealed in a box, or in its box. Not because of lack of expertise or commitment, but because the room that was built to house it turned out to be too small. Planning had failed the patient before treatment ever began. And I have seen across many low middle-income countries, equipment rendered useless for want of maintenance contracts, spare parts, or trained technicians. These are not isolated anecdotes. They are systemic failures. Because radiotherapy is not just a machine. It is infrastructure. It is infrastructure and reliable power. It is trained professionals and continuous education. It is maintenance, regulation, quality assurance, and safe patient pathways. When we treat radiotherapy as a luxury, we institutionalize inequity. And when we treat it as a core public good, we restore dignity and equity. I have seen many countries transform access, not overnight, but intentionally, by investing in people as much as in equipment, by building regional capacity, and by refusing to accept a two-tier standard of care. This is not about replicating high-income models. It's about designing fit-for-purpose systems rooted in local realities. And aside of speaking about the effects of lack of planning on access to radiotherapy, we must also acknowledge something far more disturbing. Sometimes we have seen, as we have seen in many conflict zones, the intentional planning to deny radiotherapy altogether. We cannot ignore the painful and harsh reality that health and radiotherapy included are increasingly being utilized as weapons of war. Cancer patients in Gaza, for example, many of you people perhaps didn't know, have long been denied access to radiotherapy, one of the most essential modalities of cancer care. And in other war-affected regions, patients face similar cruel deprivation in health services. This is not failure of infrastructure, it is not failure of technology, it is failure of humanity. As global health advocates, we must decry this, not only for Palestinians caught in conflict, but for all cancer patients trapped in war zones, whether in Ukraine and other places affected by conflict. This brings me to leadership. Health, of course, is political. And yet we need, we need political will to place cancer control on the agenda. But political will alone is not enough. What we need urgently is what I call executive implementation leadership. Too often we equate leadership with titles, offices, or organizational charts. Yet the most transformative leadership in cancer care rarely looks like that. True leadership is one that understands that progress in cancer care is measured in decades, not funding cycles. True leadership is the ability to convene across silos and to listen across disciplines. True leadership is to align diverse interests around a shared moral purpose and to persist long after the headlines have faded and attention has moved on. This form of leadership is especially critical in regions experiencing rapid growth and transformation, such as our regions. Because systems do not fail for lack of intelligence, they fail for lack of alignment, governance, and managerial architecture. And alignment requires leaders who can bridge government and civil society, national priorities and global partnerships, clinical excellence, and community trust. And we have seen this done. When countries such as Turkey, Taiwan, India and others embarked on major health system transformations, they began with a clear-eyed understanding of their own limitations. They recognized that most health ministries, through no fault of their own, are consumed by the daily treadmill of operations. They rarely have the bandwidth for long-term strategic planning or the deep policy work required to transform an entire health system. They also understood that real success demanded long-term vision, plans designed to outlast electoral cycles. So these countries created executive, strategic, managerial mechanisms outside the day-to-day functions of health ministries. Dedicated bodies charged with setting strategy, sustaining direction, aligning actors, and translating policy into practice. In Taiwan, they were known as health policy entrepreneurs. I love that name. In Turkey, the transformation team. In India, the planning commission team. Despite their different names, their purpose was the same: to create empowered structures endorsed at cabinet level, not just the health ministry, at cabinet level, that could bring together all parts of the health system. Their mantra became one where it is not just health for all, but all for health. They created continuity. They ensured that decisions made at the highest levels of government were carried all the way through to implementation on the ground. They examined problems honestly, tested solutions pragmatically, and became the engine that kept reform moving steadily, coherently, and with purpose. That, to me, is leadership that delivers. And there are other examples of models, such as the City Cancer Challenge model, which is rapidly expanding around the world, that follows similar principles, whereby cities are empowered through a local multidisciplinary executive committee on the ground to be the engine that accommodates and, most importantly, safeguards the one cancer control plan and the engine that drives it forward slowly but surely. Whether we like it or not, real and solid change takes time. And that is why we need to plan accordingly and match that with the right managerial structures that supports us reaching the end goal. And then comes the elephant in the room. Who will foot the bill? For countries committed to equitable access, the most powerful and most equitable instrument is investment in universal health coverage, UHC. UHC has long been misunderstood as a luxury reserved for wealthy nations. In reality, nothing could be further from the truth. As Dr. Jithinji Chitahi of AMREF Health Africa said so brilliantly, the decision to embark on the UHC journey is not because you are a rich country, but precisely because you are a poor country. Those who have succeeded in implementing UHC understood that it requires, firstly, a fundamental transformation of the system first. UHC, when done properly, is about efficiency. And efficiency demands that countries re-examine how they finance, organize, and deliver health, aligned with today's epidemiological realities, fitting systems to people's needs and realities, and not the other way around. It means strengthening primary healthcare as the bedrock of the system. It means abandoning short-term, fragmented, band-aid solutions that waste resources and deliver little. And it means confronting inefficiency with honesty. Countries that have advanced UHC will tell you that significant financing came. It came simply, for example, from reducing inefficiencies, some from increasing health investment as a percentage of GDP, and some from fair contributions by the public. Others adopted innovative financing, earmarking what I call the good taxes on tobacco, alcohol, sugar, and salt. These are the very products driving the NCD epidemic. Such taxes create triple wins. They reduce new cancer cases, they save treatment costs, and they generate new revenue for health and well-being. And of course, prevention remains the smartest investment of all. Fighting tobacco alone could prevent 1/3 of all cancers. Vaccinating girls and boys with the HPV vaccine, expanding hepatitis vaccination, and other prevention programs save lives long before they require treatment. UHC is simply not about investing more, it is about investing better. And this is precisely where investments in diagnostic tools and technological advances must be approached with intention. Purchasing an expensive radiotherapy machine, no matter how advanced, will not deliver access on its own. It will only deliver impact when it is part and parcel of an efficient, redesigned, coordinated, logical, humane system. One that has mapped the full patient journey. One that ensures transportation, affordability, referral pathways, quality assurance, and equitable coverage. That is when technology translates into saved lives. This is the difference between spending and systems building. And that is where regional platforms such as AMSTRO matter so deeply. Regions like Asia and the Middle East are not merely implementing global cancer agendas. They are actively shaping the future of oncology. They are home to some of the world's fastest growing populations, some of its youngest demographies, and some of the most complex and rapidly evolving health system transitions. Regional collaboration allows countries to learn from one another, not as recipients of external wisdom alone, but as equal contributors to global progress. Regional collaboration enables solutions that are contextual, culturally grounded, and durable. And it allows us to confront shared challenges together. Whether those challenges are workforce shortages, access to radiotherapy, or sustainable financing. Global frameworks matter. Yes, they do. But it is regional collaboration that makes those frameworks urgent, relevant, and actionable. Local ownership is, of course, where implementation ultimately lives. But regional collaboration is what allows impact to scale. We see this spirit reflected here today. The launch of the first Middle East chapter of